Good evening, everyone, and welcome to our webinar, Practical Worm Control, What, When and Why, hosted by Horseland and Virbac Australia. Thank you for joining us. It's a real pleasure hosting everyone tonight, and we've got some great speakers lined up, including Dr. Tanya Sundra and Kelly May. My name's David, and I'm pleased to be your moderator this evening. Before we begin, I'd like to go through a little bit of housekeeping, just so everyone is comfortable with the webinar platform. Those who have logged in today, you should be able to see my computer screen, which currently shows my mobile number. All participants, except for myself and the presenters, are currently on mute, just to ensure minimal background noise. On the right, you can see an image of the webinar control panel. If you can't see the full control panel, please click on the button shown inside the yellow circle, which will then expand out the full control panel. If you want my attention at any time throughout the webinar, you can click on the little hand symbol circled in green. This will just alert me that you might require attention and I can find out what you need. Now, if you have any questions or would like to chat with me during the session, simply click on the questions tab circled in red. This tab will then drop down and you can type your question into the area shown by the red arrow. Remember, you can also text me through your questions. Please feel free to send in questions at any time throughout the session. If they are urgent, I'll reply immediately via chat or text. Otherwise, any questions asked will be put in a queue and answered after the presentations. All questions are anonymous, so please don't feel shy in asking any questions if they do pop up. And finally, today's presentation will be recorded and made available to all attendees. So that's all the housekeeping done. I'd like to kick on and remind everyone attending that there are some prizes on offer tonight, including a $100 Virbac Horse Health Pack as a lucky door prize, as well as two $100 Horseland gift cards for two lucky people who ask questions during the Q&A section. These prizes will be announced at the end of the evening. Now, before I introduce our first guest speaker, I'd like to find out a little bit about everyone here tonight so our presenters can better tailor their presentations. So I'm just about to launch a quick poll, which if you're on a laptop or a computer, you can participate by selecting or clicking the answer that best applies to you. If the poll isn't working, you can also enter your answer into the chat box. So launching the first question now. And the question is, where are you joining us from this evening? Is it New South Wales ACT, VicTas, Queensland NT, WA, or South Australia? And thanks for voting. I'll be closing this poll off in 3, 2, 1. And I can share that on the screen for you. So we've got good attendance, 30% from New South Wales ACT, 38% from VicTas, 13% from Queensland NT, 13% from WA, and 6% from South Australia. Now, the next poll I'd like to ask is, how many horses do you have? Is it 1, 2, 3, 4, or 5 or more? All right, and closing this poll in 3, 2, 1. So with the audience tonight, we've got 21% with 1 horse, 30% with 2 horses, 18% with 3 horses, 4% with 4 horses, and 27% 5 or more. And 2 more to go. How often do you deworm your horse? Is it once a year, twice a year, 3 times a year, more than 3 times a year, or never? All right, and closing this poll off in 3, 2, 1. And I'll just share that on the screen again. So we've got about 13% deworming once a year, 38% twice a year, 26% 3 times a year, 21% more than 3 times a year, and 2% never. And then the final one is, what product did you last use to deworm your horse? Was it Equimax, Equimax Elevation, Strategy T, Equest Plus Tape, or another product? And closing this poll in 3, 2, 1. And I'll share those results on the screen as well. So it's 31% using Equimax as the last dewormer, 7% Equimax elevation, 23% strategy T, 25% eQuest plus tape, and 15% other. So thanks again for the high participation rate. And I'll continue to share my screen again. All right, so now that we know a little bit about everyone here tonight, I'd like to introduce our first guest speaker for tonight, Dr. Tanya Sundra. Tanya graduated from Murdoch University in 2009 and completed an equine internship at a busy performance horse hospital in the USA. Upon returning home, she spent a few years working in racetrack and reproduction clinics in Western Australia. In 2015, Tanya founded Avon Ridge Equine Veterinary Services, an ambulatory equine practice servicing Perth and surrounding regions. In 2019, she successfully completed examinations to become a member of the Australian and New Zealand College of Veterinary Scientists Equine Medicine chapter. Tanya has a keen interest in all things related to equine medicine, particularly gastroenterology, endocrinology, and parasitology. We're very lucky to be joined by Tanya, so please give her a warm welcome and over to you.
Hi, David. Thanks for the introduction. And thank you to Virbac and Horseland for the opportunity to chat to you guys today about practical worm control in your horses. So this talk is really just going to focus on providing you guys with some practical advice about what to deworm your horses with, when to do so, and why. Now, the way that we deworm horses has changed dramatically over recent years. And this has mainly been due to the fact that we now have resistance to all classes of dewormers within Australia. And what does this mean? Well, basically, it means that the parasites inside your horse now have evolved and they have the ability to survive a deworming treatment, which was previously effective at killing them. We used to recommend blanket deworming of all horses or rotational deworming. This is now no longer recommended. And this is mainly due to the fact that there's no new classes of dewormers that are available. And the issue that has been arising and will become a more pertinent issue in the future is that we'll start to see horses like this guy who's suffering a parasite-related colic, and there is no treatment that's going to be effective at killing the parasites in him. So it's not all bad news. There are some really good tools that we can implement to prevent that from happening. And this involves the use of diagnostic strategies. So if you're not already doing so, hopefully by the end of this talk, you'll start to embrace these new strategies and implement them within your own horse. So young horses are a little bit different. They are more susceptible to clinical disease, and additional parasites need to be considered in this age group. However, you can still use diagnostics to guide what dewormers you're using in this age group. I'm really quickly going to cover pregnant mares because this is something that everybody asks, especially around this time of year. So basically, your mares should be treated similar to adult horses. Quarterly fecal egg count should be performed to guide deworming, and we'll chat more about this in a little while. If there is poor management or there's a history of parasitic disease on the property, then we recommend that you deworm 2 to 4 weeks prior to foaling with an ivermectin-based dewormer. Now, this is only really if there is poor management practices, but I'm sure all you guys, if you're listening, then you're doing the right thing in terms of pasture management and stocking density, etc. Now, foaling down paddocks are really important. You want to make sure that poo is removed at least twice weekly. You can cross-graze these with other species to prevent the transmission of parasites. And you really want to avoid any paddocks which have recently been grazed by young horses, because these paddocks will be full of parasites because young stock tend to excrete the largest amount of parasite eggs onto your pasture. So when you're foaling these guys down, the little foal gets on the ground, and I'm sure you all know that foals, if anything, will put anything in their mouth. So we want to make sure that they're going onto the cleanest pastures that are available. So when we get onto foals, the main parasite of concern of these guys is what's known as ascarids or roundworms. So ascarids have a little bit of a complicated life cycle, and it wouldn't be a parasite talk if I didn't mention at least one life cycle here, so bear with me. But these parasites take a fairly intricate migration system through the foal. So they go, they ingest these eggs, it then moves through the intestinal tract, migrates to the liver, they then go into the lungs, they migrate up to your horse's pharynx, where they are then swallowed and then enter the digestive tract again. So there's no need to deworm foals less than 6 weeks of age. This is mainly because there's very few worms that are present at this age, and the worms may not be susceptible to the treatments anyway. So your first deworming should occur no earlier than 6 to 8 weeks of age. We recommend the use of a benzimidazole dewormer. It's just basically a big word for one of the classes of medications that are going to be effective against ascarids. There is widespread resistance of ascarids to ivermectin and moxidectin, and these two products should definitely not be used in foals. So the two main species of ascarids that we see are Parascaris equorum and Parascaris univalens. Now, ascarid infections are really common in foals, and the peak worm burdens occur around 5 months of age. Most horses, by the time they reach yearling age, have developed immunity to ascarids, and low levels of infection around this age group tend to be well tolerated. However, if you have a foal with high levels of ascarids, this may lead to colic, ill thrift, or potentially respiratory signs. As we previously mentioned, ascarids do have a migration pattern through the lungs. Again, don't deworm your foals with ivermectin or moxidectin. They're just not effective against ascarids. So you can see here, this was an image taken during colic surgery. This little foal had quite a significant ascarid burden, and you can see all the little worms in his intestinal tract there. Sorry to anybody who's currently eating their dinner and watching this, but there will be a few more gruesome images, but I'll try to give people a bit of a heads up. So these small intestinal impactions can occur spontaneously. They're usually triggered by a deworming treatment, and the reason for this is that these dead or paralyzed worms can sometimes block the small intestine. Now, I've commonly seen this in foals where owners have used an ivermectin-based dewormer in their young foals. Obviously, the ascarids aren't going to be killed by those dewormers, and then they go and large burdens build up, and then they go and give them a deworming treatment, which is going to be effective against ascarids, and you get these mass kill-off of worms, which then block the intestine. So these foals usually present with colic. It's a pretty serious condition. Most of them usually require hospitalization, intensive care, and surgery. So something we really want to try to avoid. So what are the recommendations for foals? We basically want to deworm them twice prior to weaning. The first treatment should occur, like I said before, around 6 to 8 weeks of age with a benzimidazole dewormer like Strategy T. We'll then perform a fecal egg count at 5 months to determine if you'll need to target ascarids or another parasite called strongyles, which we're going to come to chat about. The second treatment is then going to be at 5 months, and depending what you find on your fecal egg count, you're either going to use a benzimidazole dewormer if ascarids are higher, or ivermectin if you need to start targeting strongyles. But again, pretty simple. First deworming treatment at 2 months with benzimidazole, do a fecal egg count at 5 months, and then based on what your fecal egg count results are, chat to your vet and they'll be able to let you know what deworming product to use. Now, when we go from 6 months old to yearlings, there are other parasites that we need to consider in addition to ascarids. These include large and small strongyles. Large strongyles aren't really that much of an issue at the moment, and this is generally due to the fact that the deworming products we have been very effective against it. Tapeworms are also another one that we need to consider, and really fecal egg counts are the only way to know which parasite that we need to target. Again, moxidectin is not registered for horses under 12 months of age, so don't use it in this age group of horses. Tapeworms. Again, sorry, I said I'd give you guys a heads up on a gruesome image, but here we are. So we've got the long word for tapeworms is Anaplocephala perfoliata. And colic in yearlings has been reported and associated with tapeworms. Most adult horses surveyed have few or no adult tapeworms present. There is currently no data which indicates that treatment more than once per year actually confers any greater benefit against a tapeworm infection. Now, most dewormers in Australia are present in a combination which includes praziquantel, so there really shouldn't be any need to perform an additional treatment just to specifically target tapeworms unless your veterinarian advises so. So what do we want to do from 6 months to yearlings? These guys need a fecal egg count every 8 weeks to determine if you need to target ascarids or strongyles. Again, if you're targeting ascarids, use a benzimidazole dewormer. If you're targeting strongyles, use an ivermectin-based dewormer. They should be dewormed twice between 6 to 12 months of age, but moxidectin should not be used anytime under 12 months of age. Now, when we get to yearling to 3 years old, these are what we considered young stock. Immunity to parasites developed with time and exposure. So these guys their immune system is starting to get stimulated to parasite exposure, and some exposure is actually desirable to stimulate their immunity. But this also obviously must be carefully balanced against the risk of parasitic disease. Again, fecal egg counts really need to be used to guide your deworming products. I'm going to be saying this across every single age group of horses. So again, really important. Make sure you guys start doing fecal egg counts to determine what product to use in your young horses. Moxidectin, this is the age group where you should start using moxidectin. And this is important to target what's called encysted cyathostomes. Now, these cyathostomes can cause clinical disease in young horses as well as adults. Young horses tend to be overrepresented because they generally have a lower immunity to adult horses. They can present with signs of diarrhea, poor growth, or anemia, but moxidectin is generally considered effective against the encysted cyathostomes. These are not detected on fecal egg count, which is why we recommend a treatment with moxidectin, regardless of what your fecal egg count results show. Now, remember, resistance to all dewormers have been reported in Australia, and this also includes moxidectin. So don't be tempted to use moxidectin more frequently than you should, because you will develop moxidectin resistance in your horse. And there've been many studies that have shown that once resistance develops to any class of dewormer, you cannot deworm your horse for 10 years and you'll never reverse that resistance. So moxidectin is really a product that we want to conserve for these high risk horses, and also for treatment if your horse does happen to develop larval cythostominosis. Now, this is a very severe form of the disease where horses will develop acute watery diarrhea. And this is due to the thickening of the intestinal walls caused by these larvae, which come out in mass emergence. It's typically seen in horses about 1 to 5 years old during winter and early spring. This is in the Northern Hemisphere. I'm not sure if there's any seasonal correlation in Australia, where we don't have very well-defined seasons, especially in more of the temperate zones. So moxidectin for these guys is typically the treatment of choice. But again, your horse is probably going to require other supportive therapy like intravenous fluids and other medications too, and will be hospitalized. So your veterinarian is going to be the one to guide you on this. So what do we do for these guys when they're about 1 year old to 3 years old? Again, fecal egg counts between 12 to 18 months to determine if you're dealing with ascarids. Use a benzimidazole, like Strategy T if you're targeting ascarids. Use an ivermectin if you're targeting strongyles. You want to deworm these guys 2 to 3 times per year based on their level of risk. And when I'm talking about the level of risk, this really is determined by how often manure is collected, whether there's a history of parasite-related disease, how many horses there are on the property, what your quarantine practices are like. So we went through this in quite a lot of detail in that first webinar, which I think Virbac has on their YouTube channel. So refer to that to find out more about risk level. Again, moxidectin should be used in this age group, but it should not be used more than once per year unless you're told to do so by your veterinarian. So adult horses, these are very different to young horses, and diagnostics should form the cornerstone of any deworming program. There's no one-size-fits-all approach. So the only way to know what we need to do for your horse is to take a manure sample, send it into your vet, where they'll pop it on a slide. They'll then perform a fecal egg count, and they'll let you know what the egg count is for your horse and what parasites are present. Now, there's a bit of misinformation out there about what fecal egg counts can and can't do, so I thought I'd delve into them a little bit more. So fecal egg counts should be used, one, most importantly, to evaluate the effectiveness of the dewormer you're using. Two, identify horses that are low, moderate, and high shedders. Or three, identify ascarid infections in foals, weanlings, and yearlings, which we just chatted about. What fecal egg counts cannot do is tell you the worm burden of your horse. Now remember, more eggs does not equal more worms. This is quite a tricky concept for horse owners and sometimes veterinarians to get their head around, but we'll see egg counts of in the thousands. That doesn't necessarily indicate that that horse has more internal parasites than a horse who has a fecal egg count of 0 or 100. So just bear that in mind. What it cannot also do is identify tapeworms, pinworms, bots, or encysted cyathostomes. So the main use of the fecal egg count is to make sure your dewormers are actually working. And this is performed by a really simple test called a fecal egg count reduction test. And what you do here is you perform a fecal egg count, you then administer a dewormer to your horse, and you perform a fecal egg count 14 days after deworming. Now, depending on what dewormer you used and what class of dewormer was in that product, will determine what the threshold is and what the final result is to determine whether or not you have resistance to that dewormer. Your vet, again, will be able to guide you on this, but typically you really don't want to see any parasites after 14 parasite eggs being shed 2 weeks after administering any dewormer. If you still have quite a large number of eggs being shed on a fecal egg count 14 days after deworming, then that confirms resistance to that deworming product. And there is absolutely no need to continue to use that dewormer in your horse. Fecal egg counts also help identify low, moderate, and high shedders. Now, 20% of horses shed 80% of parasite eggs onto pasture. This is a mantra that's been held true for a number of years. And you can see here by a plot of fecal egg count results that have been performed in our lab, and the majority of horses fall under the 500 eggs per gram. So this really means that more than 80% of dewormers that are given unnecessarily. And moderate or high shedders may require more frequent deworming, but until you perform fecal egg counts, there's absolutely no way to know which horses are shedding the most amount of parasite eggs onto pasture. And again, remember that a high fecal egg count does not mean that your horse has a large amount of parasites. It really just means that they are shedding the most amount of parasite eggs onto pasture compared to the other horse, and may require more frequent deworming to reduce parasite transmission within the herd of horses that are sharing that pasture. Now, what are the consequences of deworming less frequently? Understandably, a lot of horse owners want to know and want some assurance that their horse is not going to become sick or unwell if they reduce their frequency of deworming. And this study that was performed in 2020 in New Zealand by Martin Nielsen, who's arguably the world-leading equine parasitologist, he took 93 foals and 99 mares, and they were split into different groups with different deworming frequencies. And what he found was that no horse developed colic. There were no adverse events that occurred with reducing deworming frequency. And there were actually really very few differences between the groups. So I think from this study, you can safely see that there's no health consequences for deworming less frequently. Now, we're by no means telling people to stop deworming their horses altogether. That's not what we want. But we want to reduce that level of dewormer use to really preserve the effectiveness of the deworming products we have long term. So the recommendations for adult horses are to perform a reduction test annually. That's to test how effective your dewormers are. Perform fecal egg counts 3 to 4 times per year to identify which horses are shedding the most amount of parasite eggs onto pasture. Use moxidectin no more than once per year. And remember that most horses only require 1 treatment per year. And there's plenty of other things that we can do, such as management practices to limit parasite transmission and limit the infection. So again, we've focused a lot about deworming and what dewormers to use, but really there's other management practices that are equally, if not more important, to limit parasite infection in your horse. Grazing management, again, really, really important. This is something that everybody should be doing. So we want to make sure that your pastures are not overstocked. We want to maintain, low to moderate stocking densities if possible. Don't spread manure back onto your pasture. All this is doing is just increasing your contamination of your pasture and potentially increasing the spread of infection. Poo pick, again, get out there. Everybody's more than capable of doing this, and you'll see a study shortly to show why this is really, really effective. We used to talk about dosing and moving, so deworm your horses and then move them onto a clean pasture. This is no longer recommended. What we recommend now is a dose and hold strategy. So the reason we don't recommend dose and move anymore is because you run the risk of then contaminating your clean pastures with resistant parasite eggs. So what you should be doing is administer a dewormer, keep the horse in the same pasture, pick up all this manure, and then move them on. Now, grouping animals by age is also really important if you are a stud or you do have animals with various age groups. And this because youngest animals should be placed onto the cleanest pasture. They tend to have the lowest immunity, but they also tend to be shedding the most of parasite eggs onto your pasture. So you want to rest your paddocks and co-graze it with other species. As I said, foals and yearlings will be excreting the highest number of parasite eggs onto your pasture, and cross-grazing with other species like sheep or cows will actually stop the life cycle in its tracks and reduce the parasite transmission. Now, poo picking, why is it so effective? This is an old study formed in 1986, but it has held true in that, if you look at a property where there's been no control measures to reduce the amount of parasites onto pasture, they had about 20,000 larvae per kilo. If they use a benzimidazole group every 4 weeks, this reduced that down to 10,000. They used ivermectin every 8 weeks. This reduced that down to almost 5,000. Neither of those strategies are at all what we would recommend doing now in 2022. But if you poo pick twice weekly, this reduces it down to 1,000. So you can just see what a massive, massive difference that just twice weekly poo picking can do. So quarantine deworming is a little bit different. These are horses that are coming onto your property where you don't know what their history of deworming is. What we recommend for adult horses is that they get a moxidectin on arrival to your property. If they are under 2 years of old, they should receive a moxidectin as well as a benzimidazole on arrival. And they should be quarantined for a minimum of 14 days before being turned out with the herd. Really important that manure is picked up and composted away from the grazing areas. You don't want to take this manure out and then spread it onto your pasture where it could be potentially infective for other horses that are on the property. Quarantine is also important for horses as they're moving between property to property, not only for deworming, but also to prevent the spread of other diseases such as respiratory infections. So just a few take-home messages. Current deworming practices are unsustainable. Your horse quite likely carries resistant parasites already, and this resistance is irreversible. So if we continue going down this path, you're going to find that we'll be faced with a situation where your horse may develop a serious illness related to parasite disease, and your veterinarian may not have any effective wormer that is available to treat them. So remember, do fecal egg counts, test the effectiveness of your deworming treatments, reduce your dewormer use, look after your pasture, and also make sure that young horses need special considerations. We can't treat them like adult horses, and adult horses shouldn't be treated like young horses either. So there is no one-size-fits-all program, but your veterinarian would be more than happy to chat you through what would be best for your horse. And if you have any questions, just reach out. Thank you. I'll hand it over to David.
Excellent. Thanks so much, Tanya, for your presentation. Now, if you do have any questions that you would like to ask Dr. Tanya, please type them into the chat box and we can add it to the queue. There's plenty so far already, and we'll have a good amount of time for the Q&A section. So before our second speaker for the evening, I'd just like to run a few more poll questions. So again, if you're joining us from a laptop or computer, you can participate by clicking on the answer that best applies to you, or you can type in your answer into the chat. So the first question is, how often do you perform fecal egg counts on your property? Is it once per year, twice per year, 3 times a year, more than 3 times a year, or never? All right. So closing this poll off in 3, 2, 1. Okay, and I'll share the answers on the screen. So we've got 16% performing fecal egg counts once a year, 23% twice a year, 6% 3 times a year, 14% more than 3 times a year, and 41% never. And the final poll question that I'd like to ask everyone tonight is, have you had to perform a fecal egg count reduction test, or FECRT, on your property in the last 12 months? Yes or no? Excellent. So closing this poll off in 3, 2, 1. And again, I'll share the results on the screen. So we've got 90% yes, having performed a fecal egg count reduction test in the last 12 months, and 81% no. So thanks again for participating. It's a great participation rate. So I'm just sharing my screen again. So I'd like to introduce our next guest speaker for the evening, Kelly May. Kelly is the Area Sales Manager for Equine in Eastern Victoria and is a passionate and avid horse owner herself. Tonight, she'll be complementing Tanya's presentation by discussing the different types of horse dewormers on the market and touching on points around strategic deworming practices. It gives me great pleasure to introduce Kelly tonight. Welcome, and over to you.
Thank you, David, and thank you, Tanya, for kicking us off tonight. I'm now going to present to you what our current recommendations are and how the Virbac Gold Standard range fits into those. However, before we get on to that, I've got something really exciting because tonight we're launching our new product to you, and it's called Ultimum. Tanya has been discussing the use of Moxidectin in a worming program, and we are so excited that now we finally have a Moxidectin product to offer to you. Ultimum is a long-acting wormer and boticide gel. It contains Moxidectin, which helps in treating encysted small strongyles, and Praziquantel, which Tanya spoke about earlier, that's very effective against treating tape. It's an ideal wormer for young horses and adult horses with suspected large burdens of encysted small strongyles. It's also recommended if you have a new horse. Let's say you've got a new horse arriving to your property, or you've purchased a new horse and you don't know its worming history. When we purchase new horses or get new horses, we don't necessarily know exactly how that horse has been wormed. So it's important to make sure that you get a fecal egg count, but then you'd also want to be using Moxidectin to make sure that you're covering off the encysted small strongyles as well. As said earlier, and in Tanya's presentation, that we do recommend it for use in horses over 1 year. With horses younger than that, we would use a different type of wormer, but we do use it in horses over 1 year. And the syringe for Ultimum is up to 700 kilos, which is very important in making sure that we're dosing horses correctly. Probably the biggest point of difference for Ultimum is that 700 kilos. There is another product out there at the moment with moxidectin in it, but it is a smaller tube. And a lot of people don't realise that they're possibly underdosing their horses. It is quite a large problem out there of people not doing the correct weight or a horse spitting it out, because horses do tend to spit it out. We think that we've got it all in there, but some, might escape or anything can go wrong. So the 700 kilo tube gives you a little bit of a buffer and stops you from having to buy 2 tubes to treat a big horse. It also completes our range. It fits into our gold standard program and it makes a perfect offering for all solutions for all ages. It's now time to move on to what our current recommendations are and how the products fit in with that. Firstly, we'll look at foals, or horses under 12 months. Young horses develop immunity to parasites over time, and some exposure to parasites is definitely helpful and useful to promote this immunity. However, given their susceptibility to parasite-related disease, the level of exposure must be carefully monitored and looked at for younger animals. Ascarids are the most important parasites in foals. As a result of widespread resistance of ascarids to macrocyclic lactones, or ivermectin and moxidectin, worming foals with a B-mendazole, such as oxfendazole, is highly recommended. Other compounds such as tetrahydropyrimidines, for example, pyrantel or morantel, are also very effective. So when we're looking at our worming program, we start off with the pregnant mare. We worm the mare approximately 2 weeks before foaling or at foaling to ensure that we're covering off threadworm. Threadworm is passed through when the mother lactates, so it's passed on to the foal that way. And we have had a lot of success over the years in reducing, if not eradicating, threadworm. However, if we did stop worming our mares before foaling, then we could see a resurgence in threadworm again. The first time you would worm a foal would be 2 to 3 months of age, and you would use Strategy T. And using Strategy T, you'd be using oxfendazole and pyrantel. Then we're moving on to the next worming. It would be 4 to 6 months of age with Equimax Elevation. So Equimax Elevation has ivermectin, pyrantel, and praziquantel. So when we're using Equimax Elevation, we're using it more as an all-wormer. It's got the praziquantel in there for tape. It's also got the mectins in there, which is a broad spectrum, and then you've got pyrantel in there, which helps support in combination with the ivermectin. Then from weaning, you'd start to do fecal egg counts. So you'd be doing your fecal egg counts every 3 months to facilitate what needs to be done next, because remember that we are trying to treat them all individually. Next up, we have our adult worming program, or adult recommendations. So for yearlings, so 12 months to adult horse, which we consider as 3 years, we treat all horses twice per year with an all-wormer based on fecal egg count testing. For example, you'd be using Equimax Elevation or Strategy T. And we use those 2 particular wormers because not only are they a all-wormer, they also target ascarids, so young horse worms. Ultimum can also be used for young horses with suspected large burdens of small strongyles and encysted small strongyles. Adult horses, so over 3 years of age, we'll be doing fecal egg counts 3 to 4 times a year to determine their shedding status. We need to find out if they're a low shedder or a high shedder. So you treat twice per year or when the strongyle egg counts are over 500 eggs per gram. For a high shedder, you might be required to treat up to 4 times per year. So you'd use Ultimum, which we would recommend once per year, and you'd also be using other wormers in there as well and doing fecal egg count reduction tests. So you'd need to tailor it to that horse to ensure that the program was working. And to make it easy for you, we have our wheel, which everyone knows and loves and puts on their fridge, but it's there and you'll be able to find our new worming wheel with Ultimum on that very soon in stores. And again, you can stick it up on your fridge and it's a quick and easy reference guide for you to look at. With all of our recommendations, it's really important that we make sure that we're worming horses correctly for their weight. One of the biggest issues with resistance is not only just overworming, it's also not having the correct weight of the horse, because people do underdose accidentally. Again, horses spit some out, or they're just not giving the correct amount. So we always want people to be trying, if they can, to get their horse weighed or to find a weight tape. Weight tapes are really handy in being able to get a good estimate of what your horse or pony might weigh. When you look at the weight estimation, round it up by 50. So on our syringes, you'll see that it has a calibration on there on the syringe of how you can wind it. And the best thing to do would be to add 50 on when you're doing it. And that way, if the horse spits any out or if you miss a bit or anything like that, you've got a little bit of a buffer in there. We're always wanting to make sure that we're treating effectively and not underdosing. So remember that our wormers do treat up to 700 kilos. So always check on that dial, make sure that you've got it correct, and make sure that you've got a buffer in there for if the horse does spit any out. We are proud to now offer you a full range of Virbac products to suit all of your horse's needs. And we're going to run through those now and drill down individually on how they work for your horse. We've discussed Ultimum a fair bit, but here it is again. It contains moxidectin that helps to treat encysted small strongyle burdens, and praziquantel, which is effective in treating tape. It's recommended for horses over 1 year of age, and the syringe does treat up to 700 kilos. Our combination wormers. So what are combination wormers? Combination wormers contain 2 or more different active ingredients with efficacy against the same target species, which improves parasite control and helps to manage resistance. 2 good examples are Equimax Elevation and Strategy T. Let's look at the 2 products a little bit more in depth though. Strategy T is one of our broad spectrum wormers. It contains oxbenzone and pyrantel and treats up to 700 kilos. It's in a lovely palatable vanilla flavour that I'm sure the horses love, and it's a unique combination that can be used as an effective alternative to Mectin. It controls BZ resistant worms, and it's the ideal first wormer for a foal. Equimax Elevation is another one of our broad spectrum wormers. It contains ivermectin, praziquantel and pyrantel, and it's a unique combination that has a delicious apple flavour, and it treats up to 700 kilos. It treats and controls all susceptible tapeworm and roundworm, small strongyles, large strongyles, bots, pinworms, threadworms, hairworms, lungworms, and largemouth stomach worms. It's very effective when treating young horses, and it is to be used in all horses, but especially horses that are under 2 years of age. The trusted Equimax is one of our broad spectrum wormers containing abamectin and praziquantel. It has a palatable oatmeal flavour, and it's safe to use in pregnant mares and stallions. Again, treating up to 700 kilos. The indications for Equimax include the treatment and control of susceptible tapeworm, large strongyles, small strongyles, pinworms, hairworms, largemouth stomach worms, neck threadworms, bots, lungworms, and intestinal threadworms. Equimax LV is an easy-to-use low-dose wormer containing ivermectin and praziquantel. Because it's in a low-volume syringe, it's ideal for treating horses that might be hard to worm, and it's also great for people with small hands. It's safe to use in pregnant mares and breeding stallions and treats up to 700 kilos. Razor is a broad-spectrum wormer in a concentrated multi-dose syringe. It contains ivermectin and praziquantel, and the difference is that one syringe will treat up to 2 600-kilo horses. It's therefore ideal for owners with multiple horses that want a Mectin-based wormer. It's also a really good choice for owners of large horses such as Clydesdales or draft horses. Again, it's safe to use on pregnant mares and breeding stallions as well. The last in our range is our Aeroquel pellets. Unlike other wormers we've looked at so far, Aeroquel is an oat-flavoured pellet wormer instead of paste. It contains a single active of ivermectin. Because of its pellet formulation, it's ideal for those horses that are hard to worm or that are a nightmare to worm with a paste. It's safe for use in all horses and adult horses, including pregnant mares and stallions, and treats up to 700 kilos. That brings us to the end, and I hope that you've been able to gain some understanding in regards to what our current recommendations are and how our products fit into that. As Tanya said, there are no new anthelmintics or ingredients coming out onto the market, so we do need to make sure that we are making great use of what we have and in treating all horses as individuals. So doing fecal egg counts and knowing what our horse's shedding status is. We hope that you'll go out and you'll get excited about Ultimum just like we are, and you should see that in stores very soon. Thank you very much.
Excellent. Thanks so much, Kelly, for your presentation and for giving us a glimpse into strategic equine deworming, as well as the exciting launch of Ultimum. So we're actually into the final part of the night, which is the Q&A section. So I'd like to bring back Dr. Tanya and also Kelly, which is on screen there. So we've got a ton of questions. We might not get through all of them tonight. If we don't get to your question, don't worry, we will get someone to answer them after the webinar. So I guess with that in mind, yeah, please, Kelly and Tanya, keep it succinct, but so we can get us through as much as possible. But yeah, don't feel too much time pressure. All right, so first question is, what worming products would you recommend for an old horse with a sensitive digestive system? Tanya?
Yep, look, I think older horses, we treat them similar to adult horses. So you want to do fecal egg counts to determine how often and how frequently they need deworming. Their immunity is potentially lower, so they may require more frequent deworming, but again, let your fecal egg counts and also your veterinarian guide you on the decision there. There's no real evidence, I think, that and this may be an individual horse-to-horse situation, but there's no evidence on a whole that deworming treatments actually cause colic in adult horses. So what I do recommend if people are worried about that is just to make sure the dewormer is given when the horse has got food in its stomach, and also obviously don't give it if there's been any signs of colic or any other illness that's been present.
Excellent, thanks so much, Tanya. The next question is, and we might have to keep this one shorter, but how do you perform a fecal egg count? Kelly, do you want to take that one? She might be frozen. So, Tanya, do you want to take that one? Sorry.
Yeah. It's a pretty simple process. There's we perform the fecal egg count using what's called a McMaster technique. So you get a set amount of manure. We basically weigh out that amount, mix it up with some flotation solution that causes the eggs to rise to the surface. That is then pipetted into a McMaster slide, and the eggs are then counted up and down the grid. And there's a certain calculation depending on how big the slide is, whether you're looking at half the slide or the full slide, and that calculation will then give you the full number. Again, David will probably yell at me if I try to go into details about how to perform one in real time, but that is certainly something that's available online. And I'm pretty sure Virbac has a video on how to perform a fecal egg count on their YouTube page. So have a look at that.
Thanks so much, Tanya. The next question is, I adjust my horse with 11 other horses in a large paddock. Now, how can I best protect my horse and manage my horse worming program? Tanya, do you want to take that one?
Yep. Again, when they're in a herd, it's also really important that all horses in that herd have fecal egg counts performed. So it's just performing it on one horse and ignoring the others isn't really a really effective way to manage parasites in that specific herd. So fecal egg counts for every horse 3 times a year, do it at the same time. And then what we recommend is deworm according to what your fecal egg counts are telling you. And also, really importantly, you perform some reduction tests to make sure that the dewormers you're using are actually effective.
Excellent. Thank you so much, Tanya. The next question is, it's actually about the study that you had in your presentation. I think it was 2/3 around, I think it was the 3 horses and the egg counts. How long did that go for?
Was it the New Zealand study looking at the less frequent deworming? Yeah, I believe off the top of my head, I think that went for at least 12, if not 24 months.
Okay, perfect. No worries, thank you. The next question is, how long should I leave my pasture under rest? Kelly, do you want to chime in on that one?
Well, really, I hope I've got enough reception. I seem to be dropping in and out. I hope everyone can hear me. We okay?
Yep.
Fabulous.
Yeah.
So really, it does depend. 3 months is probably a good time to be able to spell pasture. You know, cross grazing with some livestock or anything like that in between is good as well. But usually around the 3-month mark is a good time, if possible. And when it's nice and hot or nice and cold. So trying to kill off the parasite as much as we can with the weather and also resting paddocks.
Excellent.
I'll just chime in on something else there. I think that also depends on where you are in Australia. And like Kelly said, the climate. So, you know, if you're in hot, humid Queensland, there might be your parasite transmission season might be extended a little bit more because you might have that extra moisture remaining on the pasture, and those parasite eggs may remain viable for longer periods of time. Whereas in WA, in January, if we get weeks of 40-degree days, I don't care if your pastures are irrigated or not, that hot, dry season is certainly going to really reduce parasite transmission. So you may not need to spell for quite as long in those months in those kind of climatic regions. But Australia is really difficult because I think we have 4 different climatic zones. So having specific recommendations for each one of those makes it really tricky.
Excellent. Thanks so much, Kelly and Tanya. Now, the next question is there a recommendation for paddock rotation in a situation of 1 horse per acre paddock? I use minimum 3 paddocks and harrow after horses leave the paddock. Tanya?
Was the question asking, sorry, is there a recommendation for how the stocking density, the minimum stocking density?
I think so. Would be, yeah.
Yeah, look, I think and they harrow the paddocks, is that right?
That's right, yeah.
Yeah. Again, I think that we need a little bit more information to answer that in terms of where they are in Australia, what sort of climatic regions they're in, and what age groups of horses they have. So young horses, like we said, are going to be shedding a lot more parasite eggs onto your pasture. Adult horses, you know, 80% of them are going to be low shedders. So if you're picking up manure or harrowing, that can certainly reduce the parasite numbers. Again, harrowing can mean slightly different things. Sometimes that just means spreading the manure over a wider area. And if you're doing that and you've got irrigated pasture, potentially you are just spreading the parasite eggs over a larger area, which can further increase the parasite transmission. So we definitely recommend picking up manure if you can, rather than harrowing. But 1 horse per acre in general is a pretty good stocking density. So it really does depend on age groups and the shedding status of the actual animal.
Excellent. Thanks so much, Tanya. The next question is, are worming granules as effective as paste?
Well, I'm handballing that to the Virbac person.
They are absolutely effective. The difference when using Aeroquell is it is just ivermectin. It doesn't have anything else in there. There's no praziquantel in there. So it's broad spectrum. However, you are better off using a paste if you can get it into your horse's mouth, because we do want you to get that praziquantel in there as well. So the answer is try and worm them with a paste. There are many ways if you do have trouble worming horses that you know, that you can look into. There are worming bits that you can get for your horse where it goes in the side of the bit. You can try lots of different methods, and if you're inexperienced in doing it, seek help. Most horses can be wormed. you know, if you're ever getting them sedated to have their teeth done, chuck a wormer in anytime that you can. Just try and get one in there, because we really do want you to be able to get that praziquantel in as well.
Thanks so much, Kelly. This is more of a statement. Thank you for highlighting the high FVC does not mean high worm burden. That's good advice. The next question I have is, it's about moxidectin. So the question is, before you said that you couldn't use moxidectin in horses under 12 months of age. Is that correct? I thought it was only under 4 months of age.
Yeah, so that was that came up recently in a conversation. So I certainly don't recommend using moxidectin in horses under 12 months of age. I think it's got a registered label claim, and again, don't quote me on this, but I think it's got a registered label claim for horses much younger than that. But it's certainly, you know, we want to preserve moxidectin for horses who are at high risk for larval cythostomonosis, and that is certainly not for horses under 12 months of age. It's when you get from yearlings to 2-3 years, that's when that risk certainly increases. So I would be preserving moxidectin for use in that sort of age group, and not younger than 12 months, personally anyway, unless your vet has told you to do so, because in your situation they feel that larval cythostomonosis is potentially going to be a cause of clinical disease.
Excellent, thanks so much, Tanya. So the questions are still coming through thick and fast. So I think we've got time for about 4 more questions. So the first one is, my question is, if I perform a fecal egg count and then 14 days later do so again, if one horse is shedding more than the others, what do I do for that horse?
I guess are they talking about the result on the reduction test? So if the reduction test comes back with a value that's still shows a significant worm burden, that just means that you have resistance to that particular class of dewormer in that particular horse. So it's important that you work with your veterinarian with that, in terms of working out what the thresholds are to determine whether you have resistance. But ideally at 14 days, you really don't want to see any amount after deworming. So again, there are a small number of horses, like I said, 20% of horses or 1 in 5 horses that will be shedding more parasite eggs, and those horses just need deworming more frequently. But if you're getting a high reading on a 14-day reduction test, that does indicate that you have worm resistance, and you should not be using that dewormer in your horse because it's not working anymore.
Right, thanks, Tanya. The next question is, hi, I was wondering what your opinion is on pasture refugia and its importance on reducing resistance.
I'm handing that to Kelly. I have trouble explaining refugia, so.
Oh, so do I, Tanya. I'm sitting here saying, no, that's definitely for Tanya, because I have trouble explaining as well. And you're the vet here, so off you go.
Well played.
Complicated.
Okay, so refugia is basically a population of worms or parasites that are left untreated, and that is one of the reasons for spreading out the deworming frequencies. So there's always some amount of parasites within your horse and within the pasture too that have escaped a deworming treatment. So those parasites then go on to reproduce and form part of the normal parasite and horse life cycle that it goes through, and it just means that you are diluting the number of resistant parasites in your horse. So non-resistant parasites are good, and that's what we want to maintain in refugia, and resistant parasites are bad. So refugia just serves to dilute out that resistant population.
Excellent, thanks so much. The second last question, for quarantine horses, why can't you just do an FEC instead of worming?
That's because encysted cythostomes, so the ones that burrow into the wall of the large colon, they don't actually get shown on a fecal egg count. So that's the one that we're quite concerned about, that can potentially cause clinical disease, which is why we want to treat with amoxidectin to get them, regardless of what the fecal egg count status is.
Also, just adding to that, remembering that a fecal egg count will not show tapeworm, it won't show pinworm. It really is focusing just on strongyles and ascarids. So if you are moving a horse to a different property, you should definitely be looking after and targeting those parasites as well, the ones that are not as harmful to your horses, but more of an annoyance as well.
Kelly, and thanks, Tanya. So we're down to our last question. Now, don't worry, if we haven't answered your question tonight, we will get back to each and every question that comes in after the webinar. So the last question I have is, how long do worms survive in manure once it is collected? Removal of manure seems to be the most important paddock management tool, so guidance here is really helpful. Tanya, do you want to take that?
Again, I think it really depends on the climate. Composting heaps manure heaps are really effective. If you can get temperatures, 40 degrees and upwards for at least a few days or weeks, the parasite eggs are not going to survive that deworming treatment. So, parasite eggs are not going to survive in that compost pile. So, if you're composting manure, then it's you want to make sure your compost heaps are turned regularly, and you get to temperatures sort of 40 degrees and above to prevent the worms from surviving.
Excellent. Thank you so much, Tanya and Kelly, for the questions. They're still coming through, so we've got plenty of questions to answer after this webinar. So unfortunately, it's time to wrap up. If anyone has questions after tonight, again, please send them through, and we can get you in touch with the Virbac representative. Remember that this webinar has been recorded and will be made available shortly. Now, before we finish, we do have some lucky door prizes to give away. The lucky winners for tonight are, for the Virbac Health Pack, is Liz Kirkham. And for the two $100 Horseland gift vouchers, we've got Ruth Walker and Jen Alexander. So congratulations, and we'll be sending out your prizes to you shortly. On behalf of Horseland and Virbac, I'd like to offer a quick thanks to Dr. Tanya and Kelly for their presentations and time tonight. But most importantly, a sincere thank you to everyone attending. Thank you again. I hope everyone here has a great night, and we hope to see you again at a future webinar. Good night.
Thanks.